Hi, I'm Ami. I'm a physiotherapy graduate from St. J.S. Medical College in KM Hospital. And my topic is information therapy and rehabilitation. Since Hero has spoken about rehabilitation, she has spoken about long-term rehabilitation, including paraplegia. Today, I'm going to talk about self-care in rehabilitation and its importance and how we can inculcate in our day-to-day lives so that we can make a change and see the results in everyday life. I'll talk about information therapy first. Information therapy is a term for supplying patients with health information, thus enabling them to make informed decisions about their health and care and participate in their own well-being. The role of information therapy is the most descriptive, the richest in possible meanings, and the broadest in scope. It provides a patient with a sense of control and power by increasing the general public's knowledge concerning health issues. It inculcates a sense of responsibility in them for their own health. It will assist in self-care and decreases the usage of the scarce health resources. The rehabilitation, as it has been already spoken by Hiral, rehabilitation is a process which enables a patient to attain independent living, attain optimal function in day-to-day activity. One of the important components of rehabilitation is self-care. Now, self-care is personal health maintenance. It is any activity of an individual, family, or community with the intention of improving or restoring health and treating or preventing disease. It includes all the health decisions that people make for themselves and their families to get and stay physically and mentally fit. The various things that self-care includes is exercising to maintain physical fitness and good mental health, eating well, that's a well-balanced nutritional diet, practicing good hygiene, avoiding health hazards such as smoking and drinking, taking care of minor ailments, long-term conditions, or one's own health after discharge from secondary and tertiary healthcare, which is what I'll be elaborating upon in the next segment, and observing good ergonomics to function safely and efficiently. Now, let me throw some light upon ergonomics. Ergonomics is a science of making things of carrying out activities safely and efficiently. Ergonomics is a newly developed science and it aims at preventing injuries and microtrauma to structures by adapting various postures that minimizes unnecessary static work and decreases the forces that are acting on the body. The various principles that it works on is all work activities should permit the worker to have equally safe and healthy postures. Whenever muscular forces have to be exerted, it should be done by the largest appropriate muscle groups, and work activities should be performed within the joints about midpoint of their range of movement. Let me explain this to you by giving an example of back injury. No one is immune to back injury. Most of the times, a back injury is caused because of casual lifting of a load. Now that is because of the wrong technique that is observed and the wrong posture. So ergonomics normally aims at prevention of injury. Also, it aims at recurrence of the injury if the injury has taken place, or during the rehabilitation process if the injury has taken place, it aims to help to heal the injury faster. Now, this is the proper lifting technique when you have to lift a heavy load so as to prevent a back injury. The first step will be while you are lifting. So you go down. So you have to squat from your hip and knee, keeping your back straight. While lifting it up, you have to make sure that the load is closer to your body. While carrying it, you have to take small steps and make use of the foot to direction, to steer. And while setting it down, again you have to squat from hip and the knee, avoiding any movement at the back. This technique has to be told to the patient in detail. Again, to aim at 3 points. One is to avoid the risk of injury. Second is to prevent the recurrence of injury. And the third is to heal faster. Now, as we all know, rehabilitation is a long process. Therefore, it requires informing the patient the right way to avoid frustrations, and also it helps prevent injuries by promoting self-care. As we all know, prevention is better than cure. How can information therapy help rehabilitation? We need improved communication. As it has been said, between half and 4/5 of all the medical information was forgotten instantly by the patient. So just by educating them for the first 5 minutes does not mean that you have done your role, as in you have passed on the information. As a doctor and a working professional, I have observed that a patient believes, if you please us, we will come. If you don't, we won't. How can you please a patient? By more information, that is by transparency, by lower costs of the services, and by providing better service. As she's already told, rehabilitation is a long process. Now when it comes to back injury, now there are various ways that the back can be injured. The way I told you, the lifting technique, most of the time there is disc herniation that tends to happen. Those patients are either workers, laborers, or housewives. These patients have to be told in detail about how they can prevent the injury further, or how they can prevent the recurrence of injury by modifying their activities, by throwing more light upon how they can modify the activities by, as I told you as an example of the proper lifting technique, about how to work in their day-to-day life. Because we can't ask, for some time they can stop the health, but this rehabilitation process goes on for like a month or two. So a laborer will not sit at home because of the job requirements and money issues. That's why there are ways that we can talk or pass on the information to that particular patient about how the ways to modify the particular activity and avoid further injury. And the information therapy strategies include patient instructions after visit summaries. That is, informing the patient how to take care of themselves once they have gone home. Second, visit prep, test prep, as in informing the patient about how they can make the most out of a doctor's visit. In-depth campaigns is a new thing that has come up, wherein there are various charts with crossbars in which they provide all information about the particular thing and or about the particular disease or injury, and accordingly they help with the with corresponding symptoms and the corresponding treatment. That's how they help them. Personal prevention plans and virtual coaches, which is a new thing that is developing, has not yet totally developed. Application, how can you transfer the information therapy to the patient is, rather than the end of the encounter, patient information therapy should be the start of the process. By information therapy, prescription pads with check-off boxes, by print-to-web approaches through books and handouts, which is very essential, because if there are handouts, people normally tend to refer to them, which helps increases, which is one of the ways that a visit prep is normally seen. Study guides, and encourage people to start with the web. These are the wall charts. Like normally whenever there is an OPD service, like how it is seen in KM, it becomes very difficult to devote a lot of time to the patient, to inform them about everything. So there are these charts that are normally hung at the wall, or they are pasted at the wall, through which the patient goes and gets information about them. So I would like to conclude that we can solve neither the cost nor the quality problem without information therapy and engage the consumer.